Today we have on Dr. Robert Johnson. Many of you know him as the dentist. This is how I came to know him, was what he was referred to me. He's a dentist out of Salmon Arm, BC. He made made a completely viral video, which just kind of took everybody by storm. It took, particularly, which is surprising, the young generation by storm, which is how I came to hear of it at my university. But we're so thrilled to have him on today. I've written down kind of your background here, and it's pretty darn impressive. You correct me if I'm wrong here. You have your undergrad in honors biochemistry. Is that right, at the university?
Well, I don't technically have an honors biochem degree because I didn't want to do a research project. So I switched out in fourth year, and I just have a double major in biological and physical sciences because I had done so many 400 level biochem courses and they counted for both. So I just
Yeah.
But yeah, I started in honors biochem just because I wasn't planning on doing a 4-year degree, right? My whole goal was to get into med school after 2 years. So
Right on. Yeah, understandable then. But you've completed your dental degree, obviously. You're a dentist, and you and your wife have a private practice out of Salmon Arm.
Yeah.
And can I ask real quick? I just been reintroduced to I should say, to the first time to dentistry, and there's a few different types of dentistry. Is there any particular area you specialize in there?
No, see, and again, like technically, you're not allowed to say specialize in anything unless you're a specialist. But which there are 9, as far as I know. It might have changed because there's people trying to get, TMJ issues and sleep apnea recognized as specialties, but I don't think that's happened. So when I graduated, there were 9 specialties in dentistry. So endodontics, orthodontics, periodontics, public health, radiology, whatever, oral surgery. And so, yeah, so I'm not a specialist in anything. I've done a whole bunch of CE and a bunch of different things though. So, but I'm kind of trying to carve out this niche. I literally tell patients all the time in the office that dentures and oral surgery were the only 2 good parts of an otherwise worthless program when I went through dental school. And so I'm trying to carve out this niche of, like, if you need all your teeth pulled and get dentures put in, come and see me for that, because I've given up on solving all the world's problems and trying to figure out what a healthy human being looks like and how to keep people's teeth in the face. So
Yeah, right on. Yeah, it must be interesting having people come in continuously, as we do as humans, with different kind of ailments, and I must almost be trying to solve a final solution in a sense, right? Like that's got to be a difficult kind of task.
yeah, like there's different people that show up to a dental office, right? Like some people, because of cost or fear or whatever, they don't come in unless they're in pain and you're just pulling out whichever rotten tooth is hurting, which is pretty garbage.
Mm-hmm.
And then there's people the thing that's always bothered me the most is the people that actually show up every 6 months for 40 years and their mouth is still a slow motion train wreck because we suck at our jobs. So that's why I spent like 4 years walking around saying there's got to be a better way, there's got to be a better way, there's got to be a better way. And then I stumbled into that orthotropic stream that I'm always ranting about. I don't know if you heard the Kid Carson podcast that I did. And so
I did hear that, yeah.
But that, looking back, I say that I answered like 1,000 of my questions, but created 2,000 more, and that just kept on getting worse, and that's why I gave up. So
yeah, and you must see it all as being a private practitioner in a small town, in a unique community, Salmon Arm. For those who haven't been there, I mean, that's got to be an interesting place to live and to work, right?
Yeah, that's cool.
Yeah, right on. So, I mean, I say again, I was introduced to you as the dentist, which is, I mean, there's a lot of different characters that came up and, spoke kind of openly and freely about what's been going on over the past 2 years. And, for a young person, a lot of, it was interesting to see what actually made it into, young people's minds and what actually was able to stick and kind of connect and people were able to resonate with. There's famous celebrities who made statements, and all the way from politicians and all the works. And I just kind of felt like, gosh, there was no one who really just kind of was able to send home the point. And that's funny enough until early March of 2022, when I'm at university and people are coming up, and I for about a week, I heard, oh, you got to see the dentist. And this is from people who were all over the kind of spectrum, right? Where this is, vaccinated, unvaccinated, and, with different feelings about COVID, about the mandates. And people kept saying the dentist. And then finally we're at kind of a social gathering and with a bunch of different people, and there's about 10 people sitting around a table, and someone had the video of you, and yeah, I knew the people who were watching, and they were from very different, they think very differently. Some really supported the mandate, some really disliked it. It was about kind of half, if you were to lay it out. But at the end, one of the most pro-mandate people I knew who was there said, well, gosh, I got to give it to him. He's a really honest guy. And that's what everyone said. They go, yeah, he's really honest. Wherever you fall, And I don't know if that's what sent it home with so many people. Why made that video so viral. But I think it wasn't just that you were a medical practitioner, but you were a business owner, right? Like that's got to be two of the hardest hit areas in for the past 2 years, in BC and across Canada and across the world. Those two fields, it's just been crazy. So I know the letter came, or the video was shot in response to kind of a letter, if that's correct, a letter you received from one of the colleges, the BC College of, or sorry, someone had sent a letter to the college there. I don't know if that's right. Can you maybe fill us in on how that worked and what happened?
Yeah, so it's all just kind of crazy how so because yeah, what happened was it's around October, I think. I had well, first of all, like I absolutely lost my shit. Are you allowed to swear? I'm
Yeah,
kind
please go
of
right ahead. Yeah.
because I'm so mad
All
right
good, all good.
no, I'll try not to. Anyways, I lost it. I completely lost my mind when the public sector mandates happened in BC, right? I was like, this is just unacceptable on every level. Like, what the hell is going on around here? Why are these healthcare workers not revolting?
Mhm.
Like, that's my whole issue. Is like this never should have ever gotten past that. Is like the second this idiot brings up this concept, we say, fuck that, we're not doing that. Okay. And so I was already losing it. So then which people kept on giving me crap for. Like that was the only the only real negative feedback on that whole video was like, where the hell have you been for the past 2 years? Like, why didn't you say anything when they did this to the nurses? And I was like, no. So anyway, so yeah, so basically there's some goofball who I've never met or spoken to, which is important because this should have never emails the College of Dental Surgeons of BC and says, I don't know where the college stands on these matters, but Dr. Robert Johnson is an avowed anti-masker, anti-vaxxer, and he doesn't follow the public health orders, and he's putting the whole community salmon arm. He's a health hazard, right? And so these morons at the college send this to me to respond to these allegations like this is a legitimate complaint. And so I went I sent them this. I should actually post this online somewhere because I sent them this 2-page tirade of a response, which is a lot of what was in the video, right? So that's the whole thing. Is like I mean, I maybe could have done it either way, but the reason I was able to shoot that video is because I had to waste my time
Yeah.
formulating a response to this bullshit complaint, right? And then I don't know if you know the whole like I've told this story a few different places, but this BC Healthcare Collaborative, right? Like that actually started as 6 dentists, of which I was one of them. But I don't really know how to use Telegram, and I hate all the friggin' groups, and I don't pay attention. So I was really not involved. And then they had this weekly Zoom meetings on Sunday nights, and I just happened to catch the tail end of the meeting where they're talking about how they need like a public awareness campaign about this problem because people don't even know it's a thing, right?
Yeah.
And it's funny that you said that the thing that seemed, I mean, who knows what the hell was going on with why anyone white resonated with people, but the honesty factor was like, I had said that I would do it. And the Laura, who we jokingly refer to as the leader of the resistance, was like, no, you can't, like, if you try to do anything, the media or whoever is going to go back through your Facebook for the past 2 years and
Uh-huh.
dig something up to discredit you.
Yeah.
And I said, no, you cannot discredit the truth and authenticity. Like,
Right
there's
on.
nothing that I've said on Facebook in the last 2 years that is going to age poorly. And so I just went on this right. Like, the timeline of this is so ridiculous. It's funny that you call me the dentist because, like, that video, I shot that on a Monday. They posted it Tuesday. Thursday, True North wrote an article. I don't know if you saw that article
I
called
saw the article. Yeah.
Savages, Bonnie Henry. Friday, Castanet had an article. Saturday, we had this huge rally in Salmon Arm where people convoyed from a Soyuz because they were going to like link arms across the Trans-Canada Highway. So at least 100 people. I'm walking around with my friends and people are like, "Are you the dentist? Are you the
Yeah,
dentist?"
yeah, yeah. Just like that, eh? I
Yeah.
mean, it's
And
incredible.
so I said, "I'm like, I'm gonna get a T-shirt. Yes, I'm the dentist." Like I told all my
Yeah,
friends, you got to refer to me as the dentist from now on. So
yeah,
it was
totally.
total insanity. Like I got hundreds of emails and phone calls in the first 2 weeks there, and then
Yeah. Well, I mean, the letter in the first place is unbelievable. How you're a busy guy. You run a practice, and like, and it's almost kind of feels that from someone listening to the story, like it was sent to you almost as a bit of like a kind of a threat to say, like, here's a position of power. We're showing you that someone said something, and yeah, exactly. You have to respond to this and validate yourself, like to us, like or whoever said this, like. And then they didn't look into it. Like they didn't obviously look at this and just go, I mean, like,
Right. So I said in my response, I said, guys, I would be really interested to know because I've been on the radar for years, right? I've been beacon off about this my entire career. Like I did this presentation at the Pacific Dental Conference. Well, I did two presentations at the PDC. The first one was called "Our Patients Deserve Better: a new paradigm for prevention." And I was introducing orthotropics, in particular breathing and myofunctional therapy, and different ways of dealing with tooth decay and stuff. And so then meanwhile, so one of my colleagues who used to do a bunch of orthotropic treatment down in the lower mainland got completely, this is another thing that I want to try to get True North to do a story about. I tried to get Global News to do it years ago, but she got completely screwed over by the college. Like someone made a completely bogus, frivolous complaint about her, and they turned it into a 2.5 year persecution, wasted hundreds of thousands of dollars, and eventually said you can't do orthodontics anymore unless you go become a certified specialist. And so that's a big problem because the college's mandate is to protect the public, right? And instead of doing that, they're like enforcing a standard of care that is detrimental to the well-being of the patient by persecuting anyone that's actually trying to do better. So I'm not going to stand for that. But where is I even going with that now? Oh yeah, so I said to the college, I said, so then that happened, and so then I submitted this other presentation called "Our Patients Deserve Better: Part 2: A Call to Action," and I told everybody this is going to be a profanity-laden tirade against the college. Like,
Really?
pick up your pitchforks and torches and burn that organization to the ground.
Yeah, yeah.
And so they're like, I'm not, they're not a fan of me, right? So
Yeah,
so I get this letter, and I'm like, guys, like this is not happening. So I wrote back and I said, I would be really curious to know whether you've received any other similar complaints about other dentists and how you handled that, and whether you've had any complaints on the other side of this equation where patients have felt like their rights have been violated and they've been discriminated against on the basis of their medical decisions, and how you handled that. Because I have it on good authority. I got this from Charles Hoff. I don't know if you know about him.
not too sure.
The College of Physicians and Surgeons has received multiple complaints against Bonnie Henry.
Yeah.
How many complaint files exist for her?
And how many times do they contact her and say you have to respond to this complaint file?
Right.
Right. I wonder that. Like, it's funny you bring
Well, I
up
said the hypocrisy and the corruption is blatant and ridiculous. This
yeah,
is not acceptable. So
that's
I
a
don't even
perfect.
know. Like, I don't even know what they're gonna do because I've been like, every time I get an email from them, I screenshot it and my response and I post them both on Facebook, and I've just been like,
Yeah. Well,
I'm
and
not,
it's left people to wonder, like, who is this college? I mean, we obviously hear about the colleges now. That's been obviously for 2 years been a big thing. It's interesting to have your perspective that there's a whole kind of background to these organizations. And I mean, for someone who doesn't know, is this made up a group of senior, physicians, or like a mix of different practitioners, or and how do they come to be this kind of wild, crazy organization that seems to have no, pardon me, common sense in this
yeah.
whole thing and be very biased? Is that something
See,
that,
I don't even honestly know because that's the problem. Because like, who gives a shit? Like, I can't even waste my time. Like, because they're doing this whole restructuring thing in BC, anyways. I don't know if that's nationwide or what. Where they're like amalgamating all the health. Like, they're basically trying to socialize the private sector, right? Like, it's just this is why this is all so bad, and we need to shut it all down. But yeah, because I mean, they've kind of like there's a board, right, that's made up of a certain number of dentists. Like, so there's I think that our like the College of Dental Surgeons of BC, I think regulates dentists and assistants, and I don't know about dental therapists because then there's also denturists and dental hygienists and stuff, right? And they've all got their own colleges, and so I don't even know the composition of the board. Like, it's a certain amount of dentists and some people from the public and maybe some people from the government. But then there's also like, like this whatever this nonsense complaint department is, like this inquiry committee, and like it's all like they finally, because I kept on saying to them, I'm like, listen, answer these questions. Why did you open this complaint file? This is not acceptable. And please apologize for wasting my time and wrap this bullshit up.
yeah,
I kept on saying that to them over and over. And they finally lost it, and they sent me this response. And they said, look, this complaint file was opened according to section whatever of the Health Professions Act, because the inquiry committee decided it was necessary on the basis of this legitimate complaint that was received from a member of the public. Because I don't know where I got this idea from. It's somewhere on their website, I think. Like, my understanding is that, when the college receives an actual complaint from anybody that's actually been treated by a dentist, the they're supposed to tell the person to attempt to address the concerns with the dentist directly. Like, you don't just go running to the college
Yeah.
complaining about a dentist when you haven't even made any attempt to.
And they
And
weren't even a patient of yours. Sorry. Is
right,
it?
that's what I said. So I'm like, why was this person not told to contact me directly like an adult
Yeah.
and try to address his concerns?
Yeah. Yeah.
That's how that should have been handled. Like, there's
Totally.
no excuse for opening this complaint file. So, but it's just been like, and the problem is now I've got two, because now, and the thing is like, the after the video comes out, this thing gets a few 100,000 views. One moron writes into the college and it says, and the whole complaint is spreading COVID misinformation and fear mongering on social media.
Yeah. Yeah.
And a link to the video. So it's like, that has nothing to do with anything that's going on in my office, right?
No, no, absolutely not. And what misinformation is there? Like, it would be nice if the college even attempted
Yeah,
to vet anything, because there was nothing at
right.
all that had anything to do with.
Provide a counter argument to one thing I said in that 10-minute video, please.
Exactly. Yeah. 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 Yeah.
Good luck with that.
And that was why everyone who watched it went. I mean, it's a valid. I mean, this is a concern not only as a practitioner but as a business owner. Like, what the heck is going on, right? So, and I mean, yeah, yeah, and that's why it was so effective. It was kind of for young people also, like, enough is enough, right? Kids knock it off, right? It reminds you as you're a kid, right? And you might be playing around too much, or you're getting your muddy shoes in the carpet, and a parent kind of comes in and goes, knock it off, right? Enough is enough. Playtime's over. And that was it was a little bit of a wake up. So, I mean, yeah.
Yeah, like, I reached my tolerance limit for ridiculous bullshit nonsense on March 20th, 2020. Like, I was like, I'm not doing this on any level.
Yeah.
And it's been over 2 years since that day, right? And it's only gotten orders of magnitude worse.
Yeah.
And so I can't do this. Like, there's no.
Well, and you made such a good point earlier, now that one I've been kind of saying to people for a long time since I heard the Kid Carson interview. Great thing to say. It's kind of 2 points you've been telling people to implement or think about. Sorry, I actually have to. Yeah, people use common sense. Get people to use common sense. Have basic common sense, and for people to figure out what line they're not prepared to cross. I mean, I love those ones. I say that to people, like, that's, you can think about that, right? Like, I'm not telling you to think about. You think about it, right? So, I mean, with a lot of these issues we're facing, it's actually basic common sense is not there at all. That's why we're
Right. I mean, that's what I said to people is, I'm like, listen, they cut this out of the video for some reason, maybe because I said I wasn't going to comment on masks, and then I just made this comment. But I said, I'm like, if you have gone to a restaurant in the past 2 years and wore your mask from the door to the table, and then sat there for hours with no mask on, don't talk to me about wearing a mask in the grocery store. Like, pull your head out of your ass.
Yeah.
Like, I was going to take the other day I was taking out some kid's wisdom teeth, and I somehow got a bunch of blood splatter on my mask, and I was going to take a picture and be like, this is why I wear a mask at work, you jackass.
Yeah.
Like, you get a lot of blood splatter on your mask in the grocery store?
Yeah.
I don't think so. Like, these are procedural masks. This is not a.
Yeah. Exactly. I
But
mean,
the thing is, there's like 500 of those, right? Like, I was sitting with some friends and we were chatting, and people were talking about all the different logically incoherent nonsense, and I was like, there's like hundreds and hundreds of examples, right?
yeah.
And you don't.
You can only explain to somebody 1 + 1 doesn't equal 3 so many times, right? Like, that's kind of what it feels like. People ask me, like, where do you? I just don't even. I was we had an interview with Kid Carson this morning, and it was funny because we were together. Yeah, we were hashing some of the things that occurred, particularly in BC over the past 2 years. And I mean, you don't even know where to start, right? It's like your head's like spinning. It's almost like an attempt that's like almost part of their game plan is to get you so discombobulated, because you don't even know where to begin to tell people, like, come on, exactly like you said, pull your head out of your ass is part of my language, but it's quite similar to that. So, I mean, I just want to touch on too, for people who don't know, I mean, I feel like we've got our own little BC club going here, because it's, every province was different, every state in the US, everywhere has been a little bit different, but BC, I mean, did some kind of, like, it felt like last minute. I use the word kind of vicious, and I use that word, I kind of try to be careful with my words, but to vicious act towards the private practitioners, private medical establishment. Any private medical practice, and this includes, and correct me if I'm wrong, like Chinese herbalists, acupuncture, like it must have spanned a huge, wide range of different backgrounds and knowledge. and obviously practices, they were going in March of 2020 to implement that you needed to have just you needed to be vaccinated as kind of a condition of licensing to actually run your business. Is that correct? Is that
That was the rumor. So yeah. So
how it
again, I
started?
think
Eh? Yeah.
yeah. So the thing was, and see, we need to touch on this too. There's some really important things that are going on right now that so I think, because again, the problem with this whole thing is like I should not be any kind of a spokesperson for anything because I don't give a shit and I don't know what's going on. So the but like because it was back in the fall, like sometime in the fall, whenever she did, and actually I should know the date on this because they were just talking about it. Whenever she did the mandate for the public sector, right? She said at that point, I'm going to do this to the private sector too. And then sometime in January, they did this press conference and they said, yeah, it's still going to happen, but it's a little harder than we anticipated. And so we had this dinner in Kelowna with the resistance, like there's about 20 of us there. And the one guy who's initiated the whole thing, like the legal side of it, and like I think actually initially like funded it himself, but then they kind of
Wow.
he said he's like that press conference was one of the proudest days of my life because that was us. Like the reason she had to come out and say we're still gonna make this happen, but it's proven a bit more difficult than we thought is because
Cool.
the guys were like, no, you're not.
Yeah. Yeah. Good.
And
Cool.
but then she still somehow in February made this announcement that it was this mandate was going to happen as of March 24th.
Wow.
And so
Wow.
that's why this whole thing happened where they were like, we need this public awareness because the problem was when she did it to the nurses, it wasn't anywhere near what it should have been, but there was some public outcry, right? There were
Yep.
some protests at the hospitals and there were some people on the side of the highways. Like I went down to Kelowna to this huge thing where we were on both sides of the highway across this big
Yep.
overpass thing. It was this whole like support the healthcare workers
Yep. Yep.
protest rally thing. But now this crap is happening and people don't even know. They're like, even the people that are on the highway protesting the general nonsense don't know that this is happening and the impact that it's going to have, right? Because
huge,
it's like,
huge. I don't know how they snuck that. It was like, and I actually felt myself kind of easing off. Like I was like, oh well, it seems like things are only going to get better. The young guy, naive.
The trucker convoy gave everyone some hope, and they thought things would kind of move, and then
exactly. We got some kind of idea for an end date. Who knows? But then, like, I couldn't believe reading that because it was like everyone had turned their back.
Yeah.
And now we're going to take a little cheap shot at this, critical, like right, like at the private medical practitioner. So yeah.
So then the problem is, well, so now she didn't do it, right? Like we managed to tell her to F off, and so. But what she did instead was this. I don't know if you even know, like, I don't know if you know what's going on now, but now, so the actual order that she put out originally back in February, March there was not a vaccine mandate. It was instead a massive privacy violation.
Yes.
So now she requires the colleges to collect everyone's, well, there was some confusion because that's the problem, right? Is it's like who has time to keep up with this garbage?
Yeah, exactly.
So I think at the end of the day, what actually happened was she required the colleges to provide our information to her office or whatever the hell, so that they could cross-reference with the database of who's been vaccinated and who hasn't, and then report back everyone's status to the college, and then anyone whose status they weren't able to confirm because either you weren't vaccinated or you could have been vaccinated in a different province or the states or whatever, right? They sent us all an email saying, please provide either, so this is the thing now, provide either proof of vaccination or proof of an exemption by the 31st of March. So we all sent back this response from the lawyers that said, as stated in this letter you received from this law firm on this date, this request is the subject of a privacy complaint, so please respect that and do not take any action related to this until that complaint is resolved. Yes. So, but then, because then there's talk of like, this is the thing, the gall of this woman, like she's talking about in the name of informed consent, so that patients can make informed decisions on who they're going to choose to see as a provider. They're going to publicize everybody's.
Holy smokes. Status. Holy. So for people listening, I mean, your jaw should be on the floor because it's a blatant. I mean, I'm barely into the world of studying law. I'm doing my undergrad in law, but I mean,
Yeah.
like,
Privacy and autonomy,
out the way, and
bedrock foundation of healthcare.
a
Bonnie
little,
Henry, not a doctor. Okay.
yeah, yeah, yeah.
Like, I
Well,
don't refer to her as Dr. Bonnie Henry.
gosh, and a little child could understand that that is a huge infringement on. I mean, that is, it's like hijacking your private information, which we kind of become like normalized with. It
I
just
know that's
sounds
the thing.
so
People are like,
weird.
"Yeah, it makes sense. We're all going to die if we don't do this, so it's for the greater good. So let's do it." That's why. What once again, which line are you not prepared to cross?
Yeah, exactly. And then
Like,
but then they complement that with, once you receive the list, then it's now being normalized to also defame and attack people for
yeah,
where they stand, right? Like, so this isn't like, thanks for being honest. It's like, well, now you're going to pay the consequence. It feels like, right, for being honest.
yeah.
But
I mean, what is the purpose of that, right? I mean, there's no
yeah,
because there's no. I mean, the problem, the thing for me that I keep on harping on is it's like so. This is a whole other. Have you seen this? I don't know where this suddenly came across because of algorithms. There's this Matt Walsh just made this documentary called
yes,
"What Is a Woman."
yes, yeah, yeah,
So I was like, and he said that because it's like people kept saying trans women are women, and he's like, well, what is a woman? And then their whole ideology collapses because it's so incoherent, it's unbelievable.
yeah, yeah.
So
Which
what's
you
the
have to be able
COVID?
to start with. You have to be able to start with it, right? If they're claiming, you have to be able to start with that. Everyone. I mean, so that's been so,
So what? So I'm like, okay, well, what's the COVID version of that? So what did people say? Well, follow the science, follow the science, follow the science. So it's like, okay, well, what is the science,
yeah,
right? And but it's important to understand that the science is not relevant, right? Like the science clearly shows that every single thing that has gone on for the last 2 years has done more harm than good.
yeah.
There's no
There's
dispute.
no, eh,
But even if it didn't, even if the science actually supported any of this bullshit, it's still not acceptable.
yes,
Like
yes.
that's the fundamental problem. Is it's like
Exactly. It doesn't matter if you're vaccinated or unvaccinated. That's what I keep telling people. Like, it doesn't, anyone can tell that this is wrong, right? Like, something is really wrong here, right? And it's actually one of those odd things where you kind of feel it. Like, it's in your gut. Like, you're like, God, this is like, that's wrong, right? And then just, I mean, I don't even know where to start, because it's been every day, it seems, blatant examples of how wrong it is. But exactly to your point. Yeah, it's so,
yeah, this is illegal, unethical, and immoral.
yeah, yeah,
Period. It doesn't even matter what the science says. And the other thing, I mean, I saw Jordan Peterson talk about how he's like, even if there was, I mean, the science is garbage. Like science, all science is mostly garbage, right? Like I consider the whole concept of evidence-based medicine the way what most people think they mean when they say the word evidence-based medicine is a farce. Like that doesn't exist.
yeah.
Um,
Do you
but
find that just be quickly because evidence changes? Is that kind of like
no, it's because there's no good evidence for anything. Like if you ever see, I don't know, maybe there's an like I mean it's been a while since I've done, but back when I was in school, right? Whenever you look at a systematic review of any topic, the conclusion is always further research is necessary to come
oh
to,
yes,
like,
yeah,
and it's like so these people have supposedly gone out and systematically reviewed the entire body of literature on this topic, and they come to the conclusion that they don't have an answer.
yeah,
So that's a problem. So that's where, like, because it's this whole thing with orthodontics and orthotropics, right? Like orthodontists are constantly criticizing the quality of evidence that supports the theory of orthotropics, and I'm always like, okay, fair enough. It makes logical sense, and there is actually pretty good evidence to support it. But if you want to say there's not, that's fine. But have the intellectual integrity to hold the evidence that supports your beliefs to the same standard,
yes, yeah,
because that's equally poor, if and it's worse.
yeah,
So here's how you do research in orthodontics: you ask the wrong question, you do a poorly designed study, and you misinterpret the result. So because that's the only way you can possibly continue to support this idea. So
yeah.
but the thing is, like the actual definition of evidence-based medicine is a three-legged stool consisting of the best available research evidence, which I just finished saying is pretty poor for most things, clinical judgment and experience, and patient expectations and values.
Wow.
So if you look at it that way, you can actually make a half-ass effort to try to do that.
Yeah.
But if you're trying to say I've got good evidence to support any of my practices, I think you're kidding yourself because
Yeah, because that fits in. I was wondering kind of what, the education system now, especially in medicine. Like, I mean, I was going to ask too. Were you always a critical thinker? What led to this? I can kind of see now. With the background here going through school, you must have been like,
yeah, I'm the most hated student that ever set foot at that institution. There's no question about that.
caused a lot of teachers to retire, pulling their hair out, going, "What? What's wrong with
It
this?"
was so good, man. It was so good. Like I
That's
wish I could go back and have even better. Like I want to try to. I got to figure out how to do this because at some point, someone from the college is going to have to call me about these complaint files, right? And I want to record that phone call
yeah,
and
yeah.
post it online because that's going to be a bad unless that phone call goes, hey, I just wanted to apologize,
Yes, yeah, and
wasting your
and
time.
and pay you back for. I
Yeah,
mean, like, come on, for all
it's
the
going to
time
be
you
a
wasted.
bad day for whoever has to make that call because
Yeah, exactly. A point I wanted to bring up too. I mean, two real quick ones. They actually have a name which has made me, like laugh in like this really unfortunate way. It's kind of like really messed up, but they actually called it a data exchange. What we're going
yeah.
through right now, right? Is that right, or did I hear that wrong? Like, I just too messed up to even think that's true. Is that right?
Yeah, yeah. It's not a privacy violation. It's not a
Holy
it's
smokes!
double speak, right? Or new speak or whatever the hell you call that. Or
Yeah.
roaming stuff where
Wow, incredible. Another interesting point. There was actually, I mean, by the time for people just to get another good sense of this, the whole effort here is to find out who is and who isn't vaccinated, as if being unvaccinated would pose a more significant threat to people in general than the vaccinated. This is particularly with transmission, but you and at least in the Kit Carson interview brought up a great point where you said at the time that they were first actually instituting the very first set of this mandate, which is to actually take away the right to practice or the licensing of a practice, there was no actual evidence that there had been any transmission from a patient to a doctor, right, to the dentist or to a dental assistant at that time. It seemed very much more that the effort of the mandate was to encourage, really force, right, because it's now coercion for people to get a vaccine. Is that, I mean,
yeah, I
that's,
mean they said that out loud, right? Like there was that one woman, Patricia Daly, that said, this is not about preventing transmission. Like there's no like even in the gyms and the restaurants and things, they're like, these are not high risk, high transmission places. This is strictly about creating incentive to improve our vaccination coverage.
yeah.
Like one of our instructors from dental school called me after the video to thank me for it.
Oh, no,
And he's like, and I told him that she said that, and he's like, so she said the quiet part out loud, hey, like,
yeah.
I'm surprised she get fired for that. Like, so yeah, I mean, there's no, yeah, I mean, obviously, like it's because the vaccine doesn't even prevent transmission, right? So it's like there's absolutely um, there's no excuse for any of it. Like it's totally preposterous.
Total, and we actually had our, I think it was the coastal health or the island health, one of the senior, I think it was actually the most senior official for that or department, had emailed the UBC,
Yeah. Yeah,
said,
that was the same woman, Patricia Daly. Like she made
was it?
that comment in the Zoom meeting a couple months earlier, and then her and three or four other people signed that, right?
Yeah, saying that there was no evidence that vaccinated to compare to
Yeah,
unvaccinated
there should be no
was.
differential treatment of vaccinated and unvaccinated people after a certain time frame, right? Like
Yeah,
that's the thing I always laugh about how preposterous the whole thing is.
yeah, yeah. Well, because it
Well,
seems,
because now they're pushing to change the definition of fully vaccinated to whatever the hell it's going to be, right? Where
yeah. Well, and it's funny too because for,
immunity boosters, like
yeah, people who haven't been vaccinated at all.
funny thing is, one of the dentists on our Telegram group said he's like, really, the only people that should count as being fully vaccinated are the unvaccinated because there's a clear inverse relationship between number of doses and efficacy.
Yes, yes. It's exactly, yeah, totally. That's a great point. It was funny. I was speaking with Stephen Pellick, who's a UBC professor a couple days ago, and he was just saying the exact same thing. So that was what seemed to be what indicating he was advocating for as well, as for that to be the new definition as well. So yeah, I mean, it's funny to see what's happened in those last couple days with the absolute theater that's gone on with the travel mandates. Like, what the heck? Like, it's just so blatant. Like, these guys are just making it up as they go along, and it's all based from what I can tell. And I did do my first kind of year undergrad, um actually with a bit of a political science kind of major. That's what I was thinking at the time, and I was seeing it was just, and I again try to use my language kind of, think through it, but I don't think I have any other explanation than a mob mentality. It was like kids who didn't know what they're doing. There was no critical thinking, and it was like, we move one way together, right? We move, and then that was the effort. It was more of a degree in marketing, and being a campaign manager was kind of the outcome, even if you did become a politician. And so that's what it's just what I'm seeing again in all this stuff, exactly with Trudeau and the whole man, the ministers, and really with Horgan and Bonnie Henry. So it's like, oh my God, right? So
Yeah, like I mean, I don't
fascinating.
know. Like I don't know. Like I have a very hard time articulating these issues, but like I had a patient in my office several years ago, and I was talking to him about how, and this kind of goes back to earlier when we were talking about the college too, and like who are these people and how's this even a thing? Is like there's so when I was in dental school, there was a bunch of like administrative staff, right, secretaries and whoever that would list like we had these class email lists like DDS 2009 at
Yeah.
ualberta.ca, would just go to the whole class.
Yeah.
So they would just like send out emails of like, oh, I came up with this stupid idea. Let's make everyone do this now. And I'm like, so you guys are like basically these people are I don't know who this there's a book called Bullshit Jobs.
Oh
You heard of
yeah.
that? Someone
No,
talked
I
about
haven't.
it
I'd love
earlier.
to hear it though. I'd love to read it.
So I'm like, so these people and this is the same thing with the college too, is it's like they're just bureaucrats who their whole what they do is make work projects for me to justify their existence, right?
Yes.
I literally told them, I said, look, if you guys didn't show up tomorrow, no one would notice, except we'd be like, why is it better? Like, why is it less
Yeah.
annoying?
Yeah.
And so I was talking to this patient about that. He said, yeah, he's like, every bureaucrat is also an autocrat. And he's like anyone who thinks they have some power over you is going to be prone to going on a power trip. Like, he's like, he's a contractor. He's like, I can't stand the woman who runs the gate at Rona.
Oh no. Yeah.
That was his example, right? It's like, and that's where like this whole thing, right, is like there's a certain personality type subset of the population that's just in their glory
Yeah.
because they just get to be the mask police, right? It's like if you walk into my dental office with no mask, one particular woman is going to lose her shit.
Yeah. Isn't
It's like
it?
you don't get to do that. Like you don't
Yeah.
like that's the whole. There was the same thing. There was a guy at the one liquor store in town. Everyone else is fine. I go in there all the time with no mask on. I buy my stuff and I leave. This one dipshit is like, "Hey, you gotta wear a mask," and I'm like, "Buddy,
Yeah.
you
Yeah.
have had 20 months to figure out how this works."
That's a great way to start it off. I've been doing that, buddy. Yeah, right. Like, let me fill you in here, man. That is perfect. Yeah, it's amazing to think. I mean, we look at all these old experiments. I'd taken one psych class as an elective, and you go
Mhm.
over. I don't know if you recall, like the Milgram experiment and the Stanford prison experiment, right, where you give people power and they just go on an absolute trip. And it was shocking in these two cases. Very famous, psychological tests.
Yeah, and that's why I say you can't like I always knew that there's no chance in hell that I would go along with any of that because it's like because I just don't do I don't follow arbitrary rules, like period. That's a fundamental principle I live my life by. It's like if there's a rule that you expect me to follow, either I better be able to figure out why it needs to exist
Yeah, yeah,
myself because it
yeah,
should be obvious,
yeah.
or you better be able to explain it to me because otherwise I'm not doing it.
Yes. Yes, and the
And
answer should make sense
yeah,
too. Yeah, yeah.
yeah,
Well, that's a funny thing in the past 2 years as well. For a lot of this, I actually don't want to, be in my own. I don't want to have these thoughts. They're unpopular in many cases. Clearly, with the trucker convoy, and there's been so much over the past 2 years that has shown that we're actually kind of maybe the majority, and we've just been being yelled at by the minority. But um, again, it can be unpleasant. You have to go through, all of a sudden arguments or discussions with people. And it'd be better if you just never had to, think freely at all. But I've gone in so many cases, I go, I actually really want to be proven wrong. Disprove me, right? Disprove my theory or disprove what I think is an issue. And for the life of the people who seem to be implementing this or in at least in very much in support of these mandates cannot do it, which is really kind of a bummer because you're like, gosh, darn, I wish it was,
well, they're not even willing to have a conversation because they don't have an argument, right? Like that's the whole thing. Is it's like I said, I'm like if you want to have a discussion about why you have chosen to approach this whole situation the way you have, my answer to that question is a 2-hour rant
yeah.
that is 100% logically coherent and has been 100% consistent for the past 2 years.
Yeah, exactly.
Your answer is because otherwise we're all going to die, or Bonnie Henry said so, or like we got to just go along. We don't want to make other people uncomfortable. Like, no,
Yeah.
absolutely not. Like I
Yeah.
had a guy, I went out to the mall in Salmon Arm with a friend of mine, and I wasn't wearing a mask because at that point I was like, I'm not doing this on any level.
Yeah.
And another guy, but my friend was, and another guy comes up and is like, hey, where's your mask? I'm like, I'm not playing this game anymore.
Yeah. Right on. Yeah.
And so my other friend is like, well, because he was one of the pastors at our church. He's like, we just do it because we don't want to make other people uncomfortable. You don't know where anyone's at. And I said, no, it is not kind to participate in someone's psychosis.
Yeah.
Like you're not doing anyone a favor or service by legitimizing the fact that they don't like. Because I before I ever heard the term mass formation psychosis
Yeah.
that Matthias Desmet guy talks about, I was already saying, 3 months in, I was like, these people are on a psychotic break.
Yes.
Like they're not living in reality.
Yeah, yeah, and we saw that again. Sometimes like it was en masse. The reactions did not match someone's actions, right? Like their reaction for it was quick to be angry, and that's a really good indicator that something was really off here, right? Like that people are willingly engaging in an angry method of conducting themselves. Like that was like whoa, whoa, whoa,
Yeah.
right? Like you would
Who
think
just
the
told me some guy just told me the other day that he was moving his family from Ontario to BC. He was like a missionary. He was living in one of the most remote places on the planet.
wow,
And then he had to come back to Canada because they lost their visa during COVID and stuff. And he was trying to move his family from Ontario to BC in a motorhome, and he was staying at someone's house in Calgary, and someone cut their brake lines. Remember when people were like loosening people's lug nuts and cutting brake lines and
yes,
stuff?
yeah, yeah.
They had like out of province plates, you know,
Oh my.
like that is just
And how that's not called out in I mean, in the media, like this is we're way beyond the point in my perspective, from my perspective of you're right, and and really I thank you for having such a clear voice in this and going enough, because we really do need enough to be said, right? Like we're not engaging anymore in this kind of BS behavior because it's actually become dangerous. This engaging and allowing for this to take place and to then to spread and to legitimize people being vicious towards one another has, we've almost nearly walked into a very freaky, which we have, circumstance here. We saw that in people being taxed and beginning to be taxed in Quebec, and the idea of prison, sending people to prison for unvaccinated. So
yeah. I mean that's my whole problem at this point is just like I have no concept of how we possibly like I don't know if you know I don't know if this is a thing anywhere else, but there's this group out of Kelowna called the Unity Group. They got this Unity movement.
no, I know of a group out of Victoria, We Unify, but I'm
Yeah, yeah, that's the thing. There's so many groups, right? That's one of the
yes,
things
yeah,
that I'm like, maybe it's okay, maybe it's problematic. I can't decide.
yeah,
But yeah, this unity group, like, and I've heard other people use this saying too, like, we're trying to put the unity back in community, right? Like because it's so, I mean, but again, I don't know how, like even like the BC Healthcare Collaborative has this campaign going, hire back our heroes. They've got lawn signs and bumper stickers and
yes.
t-shirts.
So that's great. Yeah, yeah,
And, but it's like, without a serious apology,
yes. Yeah.
like how the hell is anyone going to go back to work with these people?
It's exactly. It's unbelievable. I mean, I can't imagine, and I'm very thankful that it wasn't, my job, right? I luckily wasn't a parent during this time. There was so many issues that everyone, age demographic, the areas that your work field that you had to face, and they were separate. But even for students, exactly that. They're just kind of terrorizing us. It felt like for 2 years, right? And exact same thing.
Yeah,
We're
I was glad I wasn't in school. Like,
yeah. Yeah,
I
we never had it. I was just like, it's been really, really odd. I mean, in all levels. And you would ask the school for like, where are you getting this information? Which is what you're supposed to be doing in university, right? Critically thinking is supposed to be that if you're gonna leave
that's
with
what they say
university,
anyway.
yeah, it's what they say. I mean, I would hope that if you leave university, you leave it with a bit of, the ability to think critically. That's my hope. That's my wild, wild dream.
Leaving,
From,
just leaving.
yeah.
That is not the actual purpose of that at all.
No, it turns out, no, yeah, no, that's a pretty big red pill to swallow there when you find that out the hard way. But exactly, asking, well, can you source this information, anything like that? And he was obviously not being able to, and for 2 years, and then no apology, right? Welcome back. No apology. We're not even welcome back. Just you can come back. But
Well, so apparently now, because Bonnie Henry just put out another new order that no one even heard about, and one of the big changes is that she's now requiring or enabling the universities to collect the status of applicants to the health science programs. And somebody said one of the colleges, someone had gone to renew their license and they actually had a thing that said, are you vaccinated or like somehow there was, again, the problem is there's only two options, right? You can either be vaccinated or you can have an exemption.
yeah, yeah, yeah,
You're not allowed to be unvaccinated for
yeah,
a good reason.
yeah, yeah.
And So it's like, but I mean, the thing I don't understand, like, so this is what one of the things that I was supposed to mention. And I don't know if you've seen this, you probably have already seen this, is this, there's like this, the doctor group out of BC here, has this petition to the BC Supreme Court to do a judicial review of the original mandate of the, and and I guess they're, I mean, none of them have been working for 8 months, right? So they're pretty tapped out financially. So I think they're trying to raise some funds and also just share it and spread awareness that this exists. So I don't know if I can maybe give you or like I said, unless you already have it. I think like Laura texted me some website or something.
Please, yeah, if you got it there, we'd
But
love
it's also on the BC Healthcare Collaborative site, I think, freedomtochoose.ca. So, but they, yeah, I think the thing with that is it's like, well, and again, I listened to that because actually, with the guy who's named on it is named York. I don't know how to pronounce his last name.
Oh, yeah.
Um, he's like an older vascular surgeon,
Wow.
and he was on Kid Carson, but I was a little bit annoyed because he was talking about how um, this mandate was put in place during Omicron or whatever the hell, Delta.
Yeah, yeah, yeah.
Now,
Remember them all.
and
Yeah,
now it's Omicron, and now the vaccines aren't even effective against it, and the transmission, and blah blah blah. And I'm like, which again, I mean, that always annoys me when people talk about things that way because I'm like, that doesn't matter.
yeah.
That's not like, because that's one of the things that our group was, when they were trying to push back on this mandate, they said, well, if we win this case, is this going to set some precedent where they won't be able to just turn around and say, oh, there's a new variant, and
Yes.
now we're back to square one, and we got to. And I
That's why
said,
these groups are still formed.
yeah.
People ask why. It's like, we need that resolution.
Well, because I mean, again, I don't know where you're like, everyone seems to think the shit's really gonna hit the fan in the fall, right? Like
Yeah.
all of this stuff is like, because again, this is how this works. It's like
Yes.
they
Yeah.
push until you push back, and then they back off, and then they.
You have a great name for it. I brought it up. I wrote it down because I loved it so much. It was totalitarian tiptoe. Is that
Yeah, well,
right?
that's not mine. That's like David
That's a
Eichner.
very famous one. I love that one. It was the first time I ever heard it. So yes, but
Yeah.
just that
Well, 'cause
effort.
people
Yeah.
talk about. Have you heard of the? It's like the Hegelian dialect or dialectic. Or
Yes,
something?
I have, and I because I just yes last semester I recall hearing. Well, can you?
I don't know anything about it. Someone just used that term too, and I think it's kind of the same idea. I think because even, do you know who Majid Nawaz is?
No, I don't.
He did it. He did a Joe Rogan podcast. It's like nearly 4 hours long. He's a genius. But there was this little clip going around recently. It was only like 2.5 minutes long, where he was saying that the best thing that came out of COVID was that these idiots overplayed their hand.
Yes.
Like the WEF. He's like, everybody in this room now knows that the WEF is trying to influence the politics and the way we live our lives in Great Britain. This is a foreign unelected bureaucrat.
Yeah.
And so, but he said, he's like, the way I don't know, I can't do it justice, but he mentioned the Hegelian dialectic thing. He used it as an example of, when you're you're completely what's that word? Frick. What is that word for I'm never gonna come up with it.
No worries. What
When
happens
you're like, you're just so bought into the ideology and the dogma
Yeah.
that you don't see reality anymore, right?
Yeah.
Like you see everything through the lens of your beliefs,
Yeah.
and so you're dogmatic, you're not pragmatic, and then so he uses this. He says communists that uses Hegelian dialectic.
That's what it is. He's a famous
Try to
philosopher.
create conflict so that out of the conflict you can enforce your.
Yes.
Like that's what I like. I don't know the quote. There's been a quote going around recently about how all of this chaos is being created intentionally so that you will be begging for order to come back.
Interesting.
And it's going to be their order that they're going to impose, right? Like this whole.
Well, and they haven't.
30 Great Reset, whatever the freaking hell's going on.
Yeah, isn't it? And it's unbelievable. I mean, just to go back, great point on they overplayed their hand. I was showed a film recently a friend had introduced me to called The Big Short. I don't know if you've ever seen it. And then there's a scene in the film where the one fellow, I think they're planning on shorting the bank, which is the kind of the effort in this film, or the plot. And he leans over to his friend, and then they're talking to investment bankers or real estate brokers, sorry.
Yeah.
And they were kind of divulging that they had been giving real estate loans willy-nilly to anybody who asked, mortgages, sorry, to anyone willy-nilly. And he says, are they confessing? And he said, no, they're bragging, right, to these two guys who had it. So that's very much what it's like. It's from my basic understanding of reading case files and law. I'm going, oh my God, they're tap 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 to your co-prosecutor, whoever, right? they're actually confessing to the
Like
crimes they
they're
committed.
completely open about this. Like there's
Totally
not,
open.
it's not hidden.
Yeah, yeah. It was just shocking. So, hopefully that'll. I mean, again, in that sense that they have overplayed their hand, but it's an interesting point too. Just with having issues prior with the College of Surgeons or BC College of Physicians, if that I'm getting that
Oh,
correct
it's like for me,
for you. Yes, yeah.
yeah, it's the CDSBC, College of Dental Surgeons of BC.
Okay. So yes, that organization there, they from for years prior when you mentioned that they had opened a file and kind of attacked a co or someone you knew in the industry, in the dentistry industry, that there was kind of, it seemed to be an underlying sense of this kind of strange mentality. I don't know, maybe it was just me. I kind of almost felt that this was boiling up to something really strange when you see all these characters come out, like the WF kind of characters who have just openly divulged kind of this, the lack of integrity, lack of ethics that they've seemed to live their life by. I don't know, maybe that's just me and I'm just kind of getting that off my chest, but anyways, yeah.
Yeah, like I definitely, I mean, because again, the funny thing is, I didn't even know. Like, I just saw this recently somewhere. There's like, I can't remember. I think it was like 60 people work at the College of Dental Surgeons of BC.
Wow.
And so, which I mean, and because I can't remember how many registrants there are, right? Like, anyway, because one of my naturopath friends was like, well, we've got X number working at our college, and there's only this many of us in the whole province, anyways. And so the ratio was a bit worse for them, even. Um, but yeah, someone phoned me when the video first came out. Somebody phoned me from the college, said he was calling and I, because I'm like, hundreds of phone calls are coming in. My receptionist is like losing her
Yeah,
mind.
that's what I kept thinking, your poor reception.
Um,
Yeah,
and so I walk up to the front and I see she's got this piece of paper and it says College of Dental Surgeons of BC, some guy's name, and I was like, oh, that's gonna be a bad day for him. But but she, before she gives me the, I said, oh, what's this? And she's like, oh, he said he was calling an unofficial capacity, and I was like, okay, well, that's probably actually good then. So anyway, yeah, this guy calls me and he says, yeah, I'm just calling to say, keep your head down a bit longer because this isn't going to happen. Like, he's like, I'm 110% on your side. I've been railing against this for months.
wow.
The rest of these clowns. And he's like, the reality is, even if we want to do this, we can't. We're not going to, like, there's no like, how are you going to do this? Right. And so, which is what has always been my thing, right? Is like, so when I was in dental school, I get this letter saying that I'm not going to graduate if I don't smarten up, which I wish I had. I wish I had a copy of that still too, because that thing was a piece of work. But so then my wife starts freaking out and saying, like, shut your mouth, you moron. Like,
Oh, okay. You guys were in dental school together
yeah,
at the time. Okay.
we met in school.
Med school, sorry. Yeah.
So I said to her, I was like, Mel, like, I'm the top student in this program. Like,
Yeah.
how the hell am I not going to graduate?
Yeah. Yeah. Yeah.
Absolute nonsense.
Blatant threat. Yeah. Yeah.
So,
Well, we've seen that. I mean, and I'm thinking to myself, there's got to be some kind of law to be almost instated that you can't make blanketed threats knowing you're not going to follow through with them, but just for the sake of scaring people, right? Like that,
well, see, that's the whole thing. I mean, it'll be interesting to see. Like, maybe this whole thing will blow up in my face, and I'll get completely screwed over, and I won't be able to be a dentist anymore. But I don't believe that better not be possible, right? Like, that's my whole position. Is like I'm not. This to me is like the reason I was put on this planet. Like, this is the most fun that I've had in 15 years. Whereas most people would be like crapping their pants because but like I said, I mean, I kind of just use it as I just make a mockery of the whole thing, right? Because it's like it's preposterous. So I'm not gonna, like I said in my letter and in the video, I'm done legitimizing this by participating in it.
Yeah. Yeah.
Period. Like one good example that I've been saying to a lot of people is, and so we have something called a quality assurance program, right? Which, by the way, they were talking about changing to something even more ridiculous, which seems to have been put on hold because of all of this garbage with the amalgamations and stuff. But as it exists currently, their quality assurance program is we have to have 900 hours of practice time, and we have to do 90 hours of continuing education every 3 years in order to maintain a license.
Wow. Wow. Yeah.
So here's the thing about that. I don't know if you're familiar with this. Human beings are either intrinsically or extrinsically motivated to do things, right? So I always, like, when I graduated dental school, I wasted hundreds of thousands of dollars and did hundreds of hours, thousands of hours of continuing education because I needed to figure out what the hell was going on and learn how to do my job.
Yeah. Yeah.
not because I had some bullshit requirement from the college, right?
No.
But
Of your
but
own
now,
choice.
but the problem is a lot of people, a huge chunk of people, I don't know the number, when you put that external motivator in place and say this is a requirement in order for you to keep your license, their brain goes, what is the quickest, easiest, cheapest way that I can meet that requirement?
Yes. Oh,
Right? There's no consideration for how do I become a better dentist? How do I better serve my patients?
yeah. Yeah.
It's just how do I jump through this hoop
Yeah.
so I can keep my license and go back to drilling, filling, and billing. And
Isn't that funny too? Because that's such a
but that's counterproductive. That's
yeah.
actually worse than useless, right?
Totally, and it's got to be so tough though, because the idea of a doctor, when in whatever capacity you are, whether you're a Chinese herbalist, medicine, or a physician, whatever it may be, and as a dentist in any capacity, it's an important, it's a quintessential position because of the relationship you have with the patient, and the idea of that is so fundamental to the healthy society that like if we go back to them saying you can't practice you can't do your job anymore. It's kind of been outsourced, the legitimacy of your job, to the government, and they can kind of yank and pull on it and take it away when they say so. I mean, that is so dangerous to the people who you would be helping, right? Like in a community like Salmon Arm, if you don't have a dentist because all of a sudden he's got his job yanked from them, I mean, my God, right? You got people who really
Well,
need it.
that's what I said in the video, right? It's like no one
Yeah,
else in town does the things that I do.
yeah, it's just
It's
like,
like
and people seem
there's
not to
no people
care
there.
that that's your job. Like your job is not from me. I'm not a doctor, but just from my idea of it is that your job is not your most important relationship with the government or one of their agencies. It's with the patient. It's like I don't know if everyone does the Hippocratic oath. I don't know if maybe you can correct me if that's kind of a widespread, or maybe they have different versions depending on your background, but your specialty. But I mean, God, I just think that's so important, right? Like, it's just got to be such an important thing for people to know.
Yeah, well, see, that's what I kind of like. It's kind of funny. So somewhere along the way, like we had to do 2 years of medical school before we got into dental school, right? And because that was part of the problem, but we had like this, medical legal ethics course, and there was a definition of what a profession actually is, right? And which I've never been able to find, but it was something like it's a group of people. Say this, it's a group of people with a specialized body of knowledge that they use in the service of others. And then there's also something in there about self-regulation, which is tied into this specialized body of knowledge concept, right? Because it's like, if you're not a dentist, how are you supposed to assess the work of a dentist?
Yeah.
If we have the, which I mean, you actually can, because if you're not an idiot,
Yeah.
right? But like that whole thing is stupid. But the point is like people often say that I'm unprofessional because I don't give a crap and I swear and I do all this kind of stupid things. But I'm like, but I am extremely professional in the sense of what that word is supposed to be, in a sense that I care, I put the patient's interest ahead of my own, right? And so which is the whole issue with this whole nonsense of like, if I'm actually a professional, why the hell do I need a college of dental surgeons at BC making me jump through hoops and take continuing education and report it to them like my
Yeah.
kid, like I'm in kindergarten?
Yeah.
like
Yeah.
like we're adults, like. And
Yeah.
so that's why, like, I'm fully like, I'm gonna run in the next provincial election as a libertarian,
Good for you. Right on. Right on.
100%. And
Yeah.
anarcho-capitalist libertarian, whatever the hell you want to call it. Like I always say I've got these anarchist libertarian conspiracy theory friends on Facebook, right? Like, and so
Yeah. The
but
most
I'm just
entertaining ones to have.
yeah,
Yeah. Yeah.
I'm just I just don't like, I mean, like this whole collectivist, like I've been saying for years before COVID, I'm like, all of the problems in our society are because our education system is 100% pure garbage. And because of that, and related to that, we have this socialist ideology where a giant percentage of our population wants the government to take care of them,
Yeah. This.
which is got to be in the top 5 worst ideas humans have ever come up with.
Aren't we the funniest creatures ever? We just make these repeated mistakes
Yeah.
over
I'm like, I
and
can't do
over
this, guys. Like,
and
I can't live like this.
no, no, and well, I mean, I got it. I mean, it would be so different too. Like, and I'm kind of naive, but hey, you might have had me if you didn't fuck it up so bad, right? Like in this past 2 years, right? You couldn't have done more or less logical thinking and less logical, mandates, and then been so vicious about it, and then say it's still a great idea to have these, outsource our thinking voluntarily to the government or to an organization.
Like, I'm like, if you want something done in the most expensive, least efficient way possible, you get the government to do it. I mean, the government, like, I don't know if you saw years ago in on Toronto somewhere, there was like some hill that was going down to this bus stop, and all these senior citizens were falling down it,
I know, yeah, yeah,
getting injured and hurt.
yeah,
And so the city of Toronto is going to spend, hundreds of thousands of dollars building this staircase, and it's
yeah,
going to take years.
yeah.
So some guy goes to Home Depot, gets $500 worth of lumber, and builds some makeshift stairs, and they like,
Uh,
condemn it and tear it down.
Yes, yes. Well, it's like you said earlier, as with a bureaucrat, they need to justify their own job continuously, right? Which is kind of the opposite of having a valid job in many cases, right? I'm not to say I know of every person's role and responsibility within a bureaucratic job, but nonetheless, I found the same things in many cases with my first job in a unionized job. They would particularly go on strike just to go for the sake of doing it, right? For a 5 cent increase. And it was like, and maybe there are great unions out there. I just from my experience, and it kind of what seemed to be a bureaucratic situation, but exactly like that, and the government just trying to validate their own legitimacy in taking care of something like the hill and the stairs, right? It's got to
And
pay.
I think that's the premise of that bullshit jobs thing, is like, it's like a bullshit job is a job that adds no value to the world, right? It's like you're just shuffling papers and doing make work projects and just doing work for the sake of work that isn't actually productive.
Yeah,
And so, but he said, like, whoever I heard talking about it on Joe Rogan said, he's like, it's not a judgmental thing. It's not I'm saying your job is bullshit. Part of what makes it a bullshit job is it's bullshit.
yeah. Tough realization, eh?
Uh,
Not an easy one. Yeah, yeah, yeah. You'll need a beer after that. That's tough. Gosh, I mean, unbelievable. Um, so I know you're a dad. You got business to run there. Tomorrow you're a doctor. I just had one last quick question here for young people. I mean, what do you think is an important thing besides voting for you if you're in BC for the next election at Libertarian Rojo? But is there anything you think is important? I mean, just anything, might even be basic as an integrity, just to kind of go forward with some critical thinking. I don't know. Would there be anything you could leave kind of young people with, maybe around my age, just to go on forward?
So I guess probably that thing that I said on Kid Carson that Jordan Peterson said about, the most important skill you can develop in your life is the ability to articulate your beliefs.
Yes, yes,
Like
yeah.
work like because this is like, I hated English and social studies in school, right? So I know nothing about history, which would be nice to know now. Like, it'd be nice if they would teach history in a way like Jordan Peterson does, where it's like, hey guys, here's why we don't want this to happen again,
It's
right?
the whole point. It's the
And
whole point of history.
right.
Yeah, yeah,
And so, and then also just he talks about how, like, writing is really important because writing is the same as thinking, talking is the same as thinking.
yeah,
And so, like, that's what I've been trying to do for the past several months, is like, here's what I think.
yeah,
Like you said earlier, tell me where I'm wrong,
yeah.
right? And because I mean, again, there's so many things, and it's like you can't possibly know. I mean, I don't know. Again, like, my whole issue is like, when I found out about orthotropics, I went, holy shit! Like, it's this, you go down this rabbit hole of like, what the hell is going on here?
Yeah.
And but eventually, like, I spent a good solid like 3 years just like reading books, and I was on these forums, and I went to courses all over the place. Like, I went from September 2012 to September 2013. I went to Los Angeles 5 times,
Wow, wow,
Chicago twice,
wow,
Seattle, Vancouver, Canada, and Vancouver, Washington. Like, I went to all these courses and conferences, and
wow.
so, and then at the end of it, I was like, I can't. I mean, the rabbit hole's too deep. I'm out of here. Like, there's no. So the best that I could articulate it was, I was like, it's like the more you know, the more you realize you don't know anything, and it's like, and
Mhm.
there's not even a way to even find out things, right?
Yeah, yeah.
And so then my buddy sends me this Einstein quote that says, "As your circle of knowledge expands, so too does the circumference of darkness surrounding it." And I was like,
That's a great one.
that can't get better, right?
Yeah,
Like,
yeah.
that only gets worse.
Exactly, exactly.
And
That is such a
so,
great line.
yeah, so
That
then I'm just like, I'm out. But anyway, so that's kind of the thing, right? Is I feel like, you just have to try your best to like figure it out, like, because you can't. I mean, we live in this post-truth world, right? Where it's
Mhm.
like,
Yeah.
Like we're in this place where the radical left has like systematically taken over all of our institutions
Yeah.
and spread the most nonsense ideology the world has ever seen.
Yeah.
And people are like afraid to say no
Yeah.
because they don't want to get mobbed, right? And that's the whole thing. That's where I'm just like I'm not like when I was in dental school, we had this peer support group with a first year, second year, third year, fourth year student.
Oh yeah. Yeah.
And my fourth year student that was in my group was like, I don't know if he said this because of me or if he just would have said it to anyone, but he said, don't try to be a hero and try to change the world. Just keep your head down and fly under the radar and try to get out of here with your sanity. And
Holy smokes!
yeah, this is like second day that I'm at dental school.
Whoa! Whoa!
And so soon afterwards, once I figured out why he said that, I was like, no, no, I will change the world or I will die trying. Those are the
Yeah.
only two options.
Yeah.
Like,
Right on. I mean, I'm so thankful, and a group was just mentioning this a couple of days ago. We're so thankful. I mean, a lot of people, there's a clear call on younger people, but we're really thankful to have older people like yourself. And you're still quite young, but just, as an adult, right? It means something to be an adult, right? There's a certain amount of responsibility with being an adult, right? So you
yeah.
just gotta have your
Yeah, I mean, that's what I was saying about all the bullshit that's going on in the schools, right? I'm like, the adults need to be adults
Yeah. Yeah.
because these children, we're not doing that.
Yeah. Yeah. Great point. Yeah, exactly. It's and my big thing too is, I might lose, my what seemed to be a very promising, career or whatnot. What happens? And so our group feels the same way, right? Like this is just something you cannot leave for next summer, right? Like we don't really have, this is not something I can leave for next semester or just go, hey, whatever. It's really important job here, and we're asking for very basic things, right? Like, I mean, to hear people, I mean, like, anyways, it just gets so basic, like listen to the other person, right? Like, I hear people out, think critically. So anyways, basic stuff.
Yeah, like, I mean, I've been saying, like, I mean, there's two goals, right? It's like end this bullshit right now and make sure that this never happens again.
Yeah.
Like, which are, I mean, that second one is, well, they're both difficult, but like I said, there seems to be a lot of, like, on our dentist telegram group, people are like, the house of cards is coming down, right? CBC
Yeah.
is running articles about how Trudeau's reign is ending.
Yeah.
Bonnie Henry's got multiple court cases happening
Yeah.
against her. There was some kind of what the hell is that called now? There's some evidence that's come out that she was well aware of how the vaccines were maiming and killing people.
Wow. Wow.
As she was mandating them for everybody. So I don't know if you've seen that. There's like an 80-some page PDF of some guys put together about filing criminal charges against all of these people.
No, I haven't. I was just at a conference in Victoria though recently with some big players like Peckford and different groups, Pelican and all those sorts, and they were, there was the legal aspect to it as well. I haven't seen that. And I would love to. I know there's actually just so many legal
I
things.
know that's the problem, right? It's like, and like I said, it's 80-some pages long. Like I sent it to my 12-year-old daughter, and I said, "There's no chance that you're going to read this or understand it, but I want you to know that this exists."
Cool.
Like, I have completely weaponized these children.
Good, right on. Yeah,
My kids are
yeah,
100% ungovernable. Like there's
yeah, and it's what we should weaponizing them with knowledge, right? Like right? Like this is, it's important to learn. It's a crash course into this stuff, but like I said to someone recently, I said to Palik, I think I said, like, I need an honorary degree in medicine or something. And it's like, it would be garbage. I wouldn't be able to say it very well, but it won't be able to write a test on it. But just, you learn this stuff through the wildest ways, but it's so important too, to yeah, I mean, it helps every step, right? And for the older people to just reach to the younger people and vice versa, and to help educate each other during these difficult times. So,
well, the thing for me is like, so when I was in school, right, I was good at school. Like I didn't have to work hard or study, right? So I didn't, I mean, so everyone just said I was super smart. And I'm like, I'm not smart. But what I realized after the fact was I just knew how to learn for some reason. Like I was very good at synthesizing information, right? So I wasn't doing what most people do, which is try to memorize these learning understanding it. So I do that. So example that I use is people a few years ago, all of my Facebook friends from Alberta were freaking out about the new math, right? They got this new math curriculum and it's so stupid and it's ridiculous. So when I first heard that, I was so annoyed because I hate when bureaucrats mess things up for no reason. But then I read some stuff about the theory behind how they were teaching math now, and I said, no, don't tell me you can't learn math like that, because that's how you should be learning everything.
Wow, wow, yeah, wow,
So
wow.
I'm like, I started calling people. I was like, listen, the only reason you don't understand the new math is because you didn't actually understand the old math. Like the reason why people struggle with math is because it's too abstract and they don't understand how numbers actually work and what you're actually doing when you're doing these things, right?
Yeah.
And so I can't remember where I was going with that now. Just something about like, so that's again, I think another important thing for young people is
Yeah.
like learn how to learn, right?
Yes.
Like
Yeah.
there's a guy named Jim Quick.
You
I
haven't heard
saw
of
him
it?
speak at a Brennan Burchard thing in San Jose years ago. He's
Yeah.
like a learning and memory expert. Like look him up.
Okay.
Like he's a genius. So
Yeah.
um,
It's just real quick that I'll definitely look him up. It was Jim Quick. Sorry.
yeah, I think it's KWIK.
Okay, okay, wonderful. With I mean, it's a nice time where you're actually knowledge. I mean, I took a quantitative analysis course, which is a course I would never really take. Basic stats. I think it was like a 305 class undergrad, but it actually was the first time a guy who didn't love numbers growing up. It was the first time it was applicable, and I got a great grade in it because it was like I need to know for what's going on right now, right? How do these stats work? And very quickly, I mean, from my teacher, I was showing him graphs from our from Bonnie Henry, what our public health ministry released for BC, and he was able to go, these are junk. Like you would fail this class, which is a 305 class, if you handed in those graphs because they're made up, right? But at least it gives you this weird time and opportunity to kind of be able to apply some, different knowledge, abstract knowledge you wouldn't usually do in a situation
You know
like.
what this is just a absolutely random useless thing, but the Lee Turner, the lawyer for the doctors out here in BC,
Yeah.
like I went to the Unity group put on this panel discussion with Stephen Pellick and Lee Turner and Nina
Cool.
Krishna and Sean Taylor, and Lee had all these donut charts from the BC CDC.
Oh yeah, yeah.
They're like, why are they doing donut charts instead of pie charts?
Yeah.
Like it's just a pie chart with the middle cut out so that a donut instead of a pie. And I'm
It's
like,
my it really is.
and they're like, they broke it all down by unvaccinated, first dose, second dose, third dose for cases, hospitalizations, deaths, whatever. But the problem is the unvaccinated includes people within 21 days of the first dose. So it's like there's no honest reason to do that. Like
To break
it
them up
should
like.
be unvaccinated, vaccinated for less than 21 days with one dose, 2 dose, 3 dose, right? Like,
Yeah.
and so it's like it'd be interesting to know out of the people in the unvaccinated category, which of them are actually vaccinated for less than 21 days. Because
Yeah.
so he's putting in all these freedom of information requests to get that information, and they don't like. It's just absolutely.
Yeah. They're really good at. I like exactly like my prof said. You would fail, right? You would fail if you brought those into this class. Those are made up. Those do not make sense. And the first one I didn't even tell him it was from our public health minister. I just showed how it was structured, and he said after he was very much in agreement with us on our side, and he's actually a statistician who graduated from Harvard, so he's very respected kind of in our field at University of Calgary, but. He said that's just like total garbage. So it's funny as you learn these things from university, getting red pilled the whole way along. It's like holy smoke. So, but anyways, I know it's late and we agreed to do this. It was so kind, and it was in the evening, and you got a busy schedule, and so we were so thrilled. I called friends, and they said the doctor's coming on. That's so cool. And so, anyways, can't thank you enough, Dr. Johnson.
No, thank you guys. Like this is the thing. Like people keep thanking me. I'm like, I'm not doing jack squat. Like you guys have done all this stuff. Like same thing with the BC Healthcare Collaborative, right? I mean, those people have just done hours and hours and hours of work. I shot a 10-minute video. I didn't do anything. So
isn't that funny how it works? Yeah, it's wild. I mean, even just recently with the whole closing of the ending of the mandates there for travel restriction. I don't know if you watch hockey or anything, but there's an ex-hockey player who had made a statement, a viral kind of video.
Ray Whitney?
Yeah, Ryan Whitney, and like that.
Ryan Whitney?
Ryan Whitney, that's right.
Yeah.
That took some kind of extra step no one gets listened to otherwise, right? But it takes some hockey player from the US to say what the heck's going on in Canada. Anyways, it's like all the work groups that did work, right? I got a meeting with the Freedom to Fly guys next week. I don't know if you know them, and so I'm looking forward to chatting with them, but I'd love to hear their thoughts on that. So from another viral video guy, I mean it's interesting. But anyways, well, thanks very much for the compliment, and we're looking forward to voting for you. I am personally for the next election there for Libertarian there. It'd be great to see you.
Yeah, like I said, I'm really trying to push hard to get people to even know the Libertarian Party exists, right? Because I mean they've been around since 1980 something, but they don't have any real traction at this point. So I'm hoping, like, our election's in 2024, so we got 2 years to
Yeah.
change that. So
Well, this may be what it takes there. This may be getting you on board there. Maybe that's kick they needed, or not the kick, but that kind of support endorsement that they needed there. All your following there. So thanks so much. I appreciate it so much, and you have a great night, Doctor.
yeah, awesome. Thanks, you too.